So if we talk broadly about 2020, it's not just Elizabeth Warren Medicare for All. It's everybody in the Democratic field and even President Trump talking about how to revamp the system. What's the right question that they need to be asking?
Well, I think first, what are the problems that we need to address? And I think there are fundamentally two issues and problems. One is that our U.S. healthcare delivery system is really focused on after-the-fact care. It's focused on reactive, treating diseases all too frequently long after they've begun. We need to be much more focused on predicting and preventing disease. If we are, first of all, health outcomes will be better, and also we'll be able to control costs, because a lot of the cost in the system today, in addition to the administrative costs, a lot of the cost today is the cost associated with ultra-complex care. So that's one area that we need to focus on. A second is, although we're collecting a huge amount of data in health and healthcare today, you know, we used to have all paper records a decade ago. Now we pretty much all have electronic records. But what we've done really is to substitute. We've gotten rid of the paper filing cabinets, but we've replaced them with electronic filing cabinets. We're still not garnering the information that's embedded within that data. And until we do, we won't be able to transform health and healthcare just as the way we've done to transform so many other elements of the economy when we have really acquired and leveraged and used information. So I think those two cornerstones of the issues and problems, one being moving towards more prediction and prevention, a second being how do we really start to get information from data and then act on that information. I think those are going to be two critical areas to getting better outcomes and controlling cost.
So on your first point about preventative care, there was a really great story by Bloomberg News' John Tozzi earlier this month about United Health working with homeless people to give them housing as a way to reduce costs. What do you think about that program? Is this a good way to get at the issue?
Absolutely. We know that the social, environmental, and behavioral determinants of health account for roughly 70% of health. The medical care we provide, our genetics, that's 25 to 30% maybe. But the more that we can do to address those social determinants, access to housing, access to a good food supply, you know, I think it's a sad fact in America today that the best predictor of longevity is not our genetic code, it's the zip code where we live.
Wow.
And that's directly related to social, behavioral, and environmental factors of health.
When you look at sort of what politicians are talking about in the plans that may or may not be on the table, do they address any of this for you?
I think it's embedded within some of the messages. I would hope that it would come out more to the forefront. That is, how do we get more information from data? I am pleased that both CMS and HHS are taking the issues with electronic health records very seriously, are trying to look at ways of incentivizing better access to information and making health data more interchangeable, while absolutely protecting privacy and the security of the data. But I think it would be better for all of us if there were more attention both to the areas of prediction and prevention and to the area of accessing information from data.
Yeah, I do think it's fascinating that it's United Health, an insurance company, that's the one taking these proactive steps. Another private company getting into healthcare is Google, which is looking to increase transparency, which is one of the cornerstones you were talking about. Is there a risk, though, of putting that data in the hands of a technology giant?
I think there always going to be risks associated with electronic data. And a key responsibility for me as a physician, as a leader of an academic health center, is to earn every day the trust of the people that we take care of and more broadly of the American people. I think anyone who's working with any area related to health has to view that as their first responsibility, whether or not we're delivering health care or we're a large technology company. And a lot of gaining and sustaining trust is in transparency. It's letting people know exactly how their data is going to be used and then respecting that. So if data is not to be used for purposes of commercial activity, then that needs to absolutely be clarified and respected. Until we are able to bring together these large data sources, we're never going to be able really to get the information that's embedded within them.
So you just completed a new hospital that has really interesting technological features using robots, a lot of AI. Can you give me some examples of things that you guys have done that are unique, that actually go towards prevention and transparency?
Sure. The operations of the hospital really do leverage technology. The pharmacy, the dosing is determined by or initiated by robots, which frees up the pharmacist to really practice what they've been trained to practice and not pull medicines and count pills.
Like literally there's like a robot arm like pulling this pill here and here and counting it out.
That's right.
Wow,
that's right.
cool.
Right. And the delivery of devices and supplies to floors is done by robot-controlled wheeled devices.
It's just like the retail warehouses almost, where they go around
Yeah,
in the different
exactly.
e-commerce buckets.
Exactly. And there are a lot of patient-facing innovations in technology as well. For example, every patient has an iPad where he or she can see exactly what's going to happen during that day, where you can order your meals and also interact with your discharge planning to make sure that what you need after you get out of the hospital is in place before you leave the hospital.
And before we wrap up, I just want to get, because you're also a doctor as well as a dean, I wanted to get your take on vaping and if there should be regulation, and what's your take on where we're at with the e-cigarette world?
Right. I'm really concerned about vaping. I think on the one hand, we know that electronic cigarettes, or whatever we want to call devices that deliver nicotine in a non-combustible way, those are among the most effective ways we have to get people to quit smoking, far more effective than medications or gums or things like that. So that's encouraging. The discouraging part is I fear that we're creating a new generation of nicotine-addicted adolescents because of vaping. And the real concern is that later on, many of them may switch from vaping to combustibles. So we may create a second wave of smoking because kids have become addicted to nicotine through vaping. There's a critical period in brain development in adolescence where people are much more predisposed to becoming nicotine addicted. For someone that's in their 30s or 40s who starts to use nicotine for the first time, the risk of becoming addicted is much lower. For a teenager, it's much, much higher, and that's the concern.
And there's no
Did not know
FDA
that.
drugs, right, approved to treat teenage addiction at this point?
That's correct. That's correct. And it's encouraging to see the FDA taking more steps in this area because, back to your original question, I think regulation is going to play a very important role.